Okay, everybody, Dr. Prpich here from Vet Triage. We are continuing through May 1st, 2014, JAVMA, and we're going to be talking about osteosarcoma following tibial plateau leveling osteotomy in dogs, 29 cases, 1997 to 2011. This study comes out of vet schools in Colorado, in Ontario, Canada, a specialty hospital in Canada, in Ontario, University in Davis, California, specialty centers in Concord, California, another specialty hospital in Australia, veterinary school in Illinois, veterinary school in Melbourne, Australia, and veterinary school in Florida. So right away, when you have multiple institutions involved in one study, you know that a condition they're looking at is fairly rare because they had to pool together all their cases to even get 29 of them for this study. So that tells you something right off the bat. And then this study is focused on, just so you guys can see, it's focused on what are the chances of having bone cancer after an orthopedic surgery that's very common, like TPLO surgery. Objective is to determine the signalment, TPLO plate type, clinical staging information, treatment, and oncological outcome in dogs that develop osteosarcoma at the proximal aspect of the tibia following TPLO, and to calculate the interval between TPLO and osteosarcoma diagnosis. And here's an example of an x-ray with a dog that has a TPLO plate. That's what this is. Here it is as well. And you can see the severe aggressive bone remodeling of the proximal tibia here that is suspicious for cancer. 29 dogs. Osteosarcoma was confirmed either through cytological or histological evaluation at previous TPLO sites. Results found the mean age of these dogs were 9.2 years. Mean weight was 45 kilograms or 99 pounds. Most dogs, 81%, had swelling of the proximal aspect of the tibia, so that would be right here in this area. Lameness was found in 97% of these dogs. The mean interval between TPLO and cancer diagnosis was 5.3 years. One type of cast stainless steel TPL plate was used in most of the dogs. That made up 62% of these dogs. The remaining dogs had received plates of wrought stainless steel or unrecorded type. Median survival for 10 dogs that underwent amputation of the limb and received at least one chemotherapy treatment was 313 days. Okay, introduction. Osteosarcoma commonly arises in metaphyseal bone of large and giant breed dogs and is the most common primary bone tumor in dogs. In previous reports, spontaneous occurring osteosarcoma of the tibia account for just under 15% to 20% of appendicular osteosarcoma cases in dogs, with the proximal aspect of the tibia affected in about 7% of appendicular osteosarcoma cases and up to 53% of tibial osteosarcoma cases. There have been multiple descriptions of fracture or implant-associated osteosarcoma in companion animals. The diaphysis is reported as the most commonly affected location for both fracture and implant-associated sarcoma, but because they are typically diaphyseal, it is thought that fracture-associated tumors do not represent spontaneously occurring osteosarcoma, because naturally occurring osteosarcoma usually is in the metaphyseal regions, whereas those associated with fractures or implants typically are diaphyseal. There are many hypotheses about why fracture or implant-associated sarcomas develop, including tumor development as a result of biological effects of metals released from implants, or corrosion of metallic implants, or altered cellular activity, or excessive tissue damage caused by the fracture or presence of the implant, or infection causing osteomyelitis. The mean interval between fracture occurrence and osteosarcoma diagnosis has been reported as 5.8 years. A few reports have described osteosarcoma development at the site of triple pelvic osteotomy and total hip replacement in dogs. Sarcoma development in the proximal aspect of the tibia following TPLO is also rare. Osteosarcoma, histiocytic sarcoma, and poorly differentiated sarcoma have been reported. There's a low incidence, less than 0.075% of cases that have cancer at TPLO sites reported. Materials and methods. Dogs that were eligible for this study had osteosarcoma of the proximal aspect of the tibia confirmed by biopsy or cytology and had TPLOs at the same site at least 1 year or more prior to diagnosis of cancer. If they had TPLO less than a year before diagnosis, they were excluded. So that right away is interesting to me. They're assuming that you have to have the implant in the bone for at least a year before cancer can develop. I mean, it makes sense, like logically, but still, I don't know if that's actually confirmed that you can't have cancer before that. But their assumption is that if it's before 1 year, they were developing cancer and it just wasn't diagnosed yet before they had the TPLO surgery. So I don't know. And then clinical stage 2 is without metastasis. Clinical stage 3 is with metastasis at the time of diagnosis. Treatment was either curative or palliative, and the type of radiation therapy was either fractionated, stereotactic radiation, or coarse fractionated. Results: mean body weight 45 kilograms or 9 pounds. Mean age 9.2 years. Mostly females, mostly Labradors and Rottweilers. Lameness in most of them, weight bearing in most of them. Median duration of lameness prior to diagnosis was 4 weeks. Right limb more affected than left. 65% of dogs had elevated alkaline phosphatase activity. Radiographs consisted of an aggressive bone lesion involving the proximal aspect of the tibia at the previous TPLO site. Histologic diagnosis was in most dogs, 27 of them. The mean age at the time of TPLO was 4 years old. The plate most commonly used was 3.5 millimeter plates, type of cast stainless steel TPLO plate. As far as treatment for bone cancer, curative intent included amputation and adjunctive chemotherapy or radiation therapy with chemotherapy. And then palliative intent had palliative intent coarse fractionated radiation therapy, palliative intent radiation therapy with amputation, amputation without chemo, pathologic fracture repair, or treatment with analgesia alone. Chemo includes carboplatin, or sometimes carboplatin with doxorubicin. Pimidronate was also used in some of these dogs, tramadol, gabapentin. Outcomes: 77% were eventually euthanized because of poor quality of life or progressive disease. The median disease-free interval for those that had curative intent was 195 days. The median disease-free interval for dogs with amputation and chemotherapy was 195 days. Median survival time for all dogs was 202 days. For dogs that had amputation and IV chemotherapy, median survival time was 313 days. Survival time of the dogs that underwent stereotactic radiation therapy and chemotherapy is 141 days. Median survival time for the 12 dogs that had palliative intent treatment was 316 days. Those with palliative intent radiation therapy had survival times of 67, 165, 316, and 387 days. There was no significant association or difference between median survival times of dogs that had palliative versus curative intent, and 6 dogs that did not receive treatment were all euthanized within 2 weeks after the diagnosis. Discussion: the median survival time for dogs treated with amputation and adjunctive chemotherapy is 313 days, which is comparable to median survival times of 235 to 540 days previously reported for dogs with osteosarcoma treated by means of amputation and adjunctive chemotherapy. Most TPLO plates used for the surgery in this case series were cast stainless steel plates of single source. These TPLO plates differ from other stainless steel TPLO plates in that they are made of cast rather than wrought stainless steel. One case report raised concerns about the metallurgy, METALLURGY, of the specific type of TPLO plate and formation of sarcoma at the site. In that case report, intra and extracellular debris was found within the tumor that was assumed on the basis of appearance to have originated from the plate. Additionally, osteolysis was present immediately beneath the plate. Analysis of the plate following amputation of the affected limb revealed a degree of pitting and loss of metal on the side of the plate that had been in contact with the tibia, indicating the presence of corrosion. Another study reported that not all plates examined met the specifications of chemical composition for cast surgical implants as per the American Society of Testing Materials Standard 745, and tissues surrounding the plate had evidence of adverse reactions consistent with corrosion. In contrast, another study found consistent composition of all cast TPLO plates evaluated. Another study evaluated TPLO plates of this type following explantation and found following explantation and found evidence of crevice corrosion that may have been initiated in surface irregularities and pores of the plate resulting from their casting manufacturer. The interval from TPLO to diagnosis of bone cancer was 5.3 years. This is similar to other reports of sarcomas at TPLO sites that were 3 to 6.5 years. The mean time to diagnosis of fracture-associated sarcoma was 5.8 years. For osteosarcoma at the site of triple pelvic osteotomy was 11 years. And for bone cancer osteosarcoma at the site of total hip replacement was 8 years. Chronic inflection, chronic inflammation, local tissue reaction from the implant, corrosion of the implant, and resultant corrosion products, effects on local tissue, delayed bone healing, and decreased vascularity of the fractured bone are all hypotheses. Prevalence of fracture-associated osteosarcoma was reported in 4.5% of dogs, although the incidence of osteosarcoma at previous TPLO sites in dogs is still thought to be low at less than 1%. Both stereotactic radiation therapy and palliative intent radiation therapy can be performed adequately without plate removal with the guidance of medical radiation physicist. Interestingly, 2 out of the 10 dogs that received curative intent treatment had metastasis to a regional lymph node, which is uncommonly reported in dogs with appendicular osteosarcoma, 4.4% in one study, and has been associated with a poor prognosis with a median survival time of 59 days versus 318 days for dogs with and without metastasis to lymph nodes, respectively. The 2 dogs that had metastasis to the popliteal lymph node in the present study had survival times that were way longer, 405 and 1,388 days. So it's a good study overall. Some holes in it, obviously, because it's difficult to determine for sure. It would be good if they had noted whether or not their biopsies and cytology showed any corrosive evidence of corrosion or leakage of the metals or anything like that in their biopsy or cytology sites. That would have been good to know in this study, and of course a large number of dogs as well. But overall pretty solid. All right, we'll see you guys in the next one. Take care.